Welcome to Your Health. I'm your host, Rhonda Alford, and on this episode, I'm joined by Dr. Ugo Ezema, a pulmonologist and critical care specialist with Terrebonne General Pulmonology Care. Today, we're going to be talking about pulmonology and the benefits that it has on its patients. Welcome to the show, Dr. Ugo.
Thank you for having me.
All right, let's get started. A very interesting topic we have today. But first, we want to know a little bit more about you. Can you tell us what you do and your role at Terrebonne General?
Sure, of course. I am Ugo Ezema. I'm a pulmonologist here at Terrebonne General, and I work in the lung clinic as well as the ICU.
Okay. All right. And can you tell us more about what is pulmonology?
That's a very good question. Pulmonology is essentially just the study of the lungs, the study and practice of lung diseases and treatment and management of those diseases. Predominantly, the most common ones you hear about, COPD, asthma. Related to today's topic, of course, is also the treatment, assessment, diagnosis of lung cancer, and working in coordination with all the other specialists to take care of our patients.
Okay. So when you hear the word pulmonology, you should just equate it with lungs right off the bat.
Yes.
Okay. So tell us about the services that you provide.
Here at Terrebonne General, we have a wide variety of services where the lungs are concerned. As I mentioned, we take care of COPD patients, asthma patients, which is the large majority of our patient population. To do that, we provide pulmonary function tests. We work with our radiologists to look over and assess CT scans, especially where it relates to the lung. And of course, with the assessment for lung cancer, we work again with the radiologists and oncologists, the cancer doctors, to help diagnose and treat lung cancer. We don't do the treatment, but we help to diagnose.
Okay, very important part, because early diagnosis is really the key to better treatment, right?
Absolutely, yes.
All right, well, there's something that we have here at Terrebonne General called Navigational Bronchoscopy.
Yeah.
I know we're like the only one in the region to have that. Can you tell us more about it?
Yes, of course. First, I'll talk about what bronchoscopy is. So bronchoscopy is essentially taking a look at your lung, if you break down the word. And the way we do that is we use a camera attached to a scope going through your mouth or through your nose and go and investigate and look into your lungs. And we usually try and get samples that way. Mm-hmm. Navigational bronchoscopy is an extension of that. We use that for a lot of small spots, lesions, nodules in the lung that may be a little bit more challenging to get to. They're usually the ones that are far away out there. It's like a GPS for your lung system, for your lung, that we use to find and get adequate samples of these lesions and spots that we see in the lung.
Okay, that sounds pretty high tech. What are the advantages of having this technology?
That's a very good question. Advantages of having this technology are that we can be a little bit more precise about where we're going and minimize the risks of some of these procedures. They help with getting adequate, as I mentioned, adequate tissue sampling, as well as making sure we have the right amount and make sure we go to the right places and not getting these samples blindly. So navigational bronchoscopy helps with the entire process of being more precise with our care and biopsy.
So what is the benefit to the patient?
The benefit to the patient is it minimizes or reduces the amount of procedures you may have to go through. In one setting, we can do the traditional bronchoscopy, we can do lymph node assessment with endobronchial ultrasound, which is another type of bronchoscopy that we do, and at the same time get a sample of whatever the nodule is. So for the patient, in one setting, we kind of go through what traditionally would have been multiple procedures. And that is a huge benefit to the patient, reduces surgery time, reduces other operations, and of course, it reduces time to treatment.
Right, so time is of the essence when treating patients like this.
Exactly.
So when should someone seek help for pulmonology or for their lungs?
The right time is working in concordance with your primary care provider. From a COPD, from your traditional lung issues, COPD, asthma, again, I keep going back to those. Whenever you and your primary care have kind of hit somewhat of a wall and you just require a little bit of assistance, call your friendly neighborhood pulmonologist. We'll be happy to help. Where lung cancer is concerned, especially one of the programs that we have here at Terrebonne General, our lung cancer screening program. Mm-hmm. In that program, we are trying to establish a way to identify lung cancers earlier, identify nodules, spots, lesions that are in the lung earlier for patients who are high risk, smoking history, a little bit on the older side. And for those patients, we would recommend to their primary care provider to go ahead and refer them to a pulmonologist to take a look at those nodules and see if they require further investigation.
All right. Well, sounds like y'all are on the leading edge of pulmonology care.
We are certainly trying, yes.
Well, thanks so much for everything you're doing, and thanks for being with us today.
Of course. Thank you so much for having me.
Okay. For more information on pulmonology care, visit tghealthsystem.com. I'm your host, Rhonda Alford. Thanks for being with us, and we'll see you next time on To Your Health.